Okay, so welcome everybody and welcome to the monthly talk of Aston Interpreters Network. We've got lots of people on the call today, so that's very exciting to see so many of you, and from the name, so many of you interpreting into and from so many different languages as well. Um, Tonight, we are very fortunate to have a talk about a very interesting project. Tonight, we are very fortunate to have a very interesting talk about a project that was carried out by some of our colleagues at Aston University during COVID. And Sue Campbell, who is teaching on Aston Translate Master in Translating for Business and International Institution, a long title, will be reporting on what was a group project, including a few colleagues. The topic is very interesting because many of you are working in some maybe less used languages, or languages for which there isn't so much as far as resources and support is available. So I'm sure that the practical tips that Sue and her team use will be very useful to us all. So without further ado, I will hand over to Sue and concentrate on letting people in because I've got too much to do now. Okay, over to you, Sue, and thank you very much.
Okay, thank you. Thank you, Emmanuel. So currently I'm a teaching fellow at Aston, and as Emmanuel said, I teach on the master's programme for translating, so translating for business and international institutions. And this project was developed during COVID. So I'm going to start the slide. Can everybody see my slides? Yeah? Okay. Quick, please. There we go. So yeah, this is the abstract that you've probably read already to today's talk. And the focus of our project was about building language resources to help primarily translators, but interpreters as well, specifically non-professional volunteer translators who work from English into a variety of community languages that are spoken in Birmingham. So we were reaching out to people around the area of the university, 2, 3, 4, 5 specific wards in Aston that have high proportion of non-English speaking residents. I was a research assistant on this project. So the project was led by a colleague of mine at the time, who worked at Aston, Professor Frank Austermuhl. Some of you will have heard of Frank. And to give a little bit more background to the project itself, Frank had been involved in another Aston initiative called Villa Vision. This was back in 2018, I think. And the aim of this was to expand access to eye health services across Birmingham. So this project initially wasn't related to languages at all. It was a healthcare project. But one of the issues that came out of it was that language barriers were preventing a number of, a quite substantial number actually, of Birmingham residents from accessing the eye care facilities that were available to the community. And the fact that this had been raised by this project led to an agreement between Birmingham City Council and our Translation Studies Department at Aston to develop an approach which would be supportive to communities, empowering them ideally to be able to cope with their own translation needs without having to go and hire an interpreter, or go necessarily to a professional agency. So the project was just about to get underway, and then of course COVID came along. So we decided at that stage that we would use the language that was around the pandemic, as a case study for the project. And we had four areas of research that we'd agreed to work on. The first was providing an overview of languages other than English spoken in Birmingham, and looking at the levels of language competence in general in households in Birmingham. So we looked at the census data to develop quite area specific information about the numbers of speakers of different languages within the local area. One issue, of course, was that we were working in 2020, 2021, and the census data at that time was from 2011, so the data was already 10 years old. The current census data is being released gradually. I think a high level language information has been released, but not the low level stuff. So something that we could, or somebody could take further, is really updating the language information to a specific geographical areas for the city and for other cities more widely in the West Midlands. The second outcome that we agreed to work on was building a digital knowledge repository, so a bank of resources, basically, language resources aimed at supporting English to languages other than English translations. Thirdly, we said that we would do an evaluation of the applicability of machine translation systems, so Google Translate and its like, to public health information. And fourthly, we said that we would work on a set of translation guidelines to support community-based translation activities. So we'd provide a kind of very basic level of training that we made available online. So today, I think, given the kind of the nature of the network and the build-up of the audience, the two areas that I'm going to talk about in much more depth are the knowledge repository and the translation guidelines. But I do think that it's worth mentioning, particularly area 3, and that when we evaluated the machine translations of some of the key messages that were coming out at the time about COVID, particularly about vaccinations, we basically, what we did, we fed I think 5 key messages in English into a range of different translation tools, so Google, Bing, DeepL, and one more, I think, that's escaping me at the moment. And we gave the outputs of the machine translations to various members of each language speaking community to get their feedback on how well they understood what they'd been given in what was supposed to be their own language. The languages that we were working with particularly were Urdu, Somali, Bengali, and one more as well. For some reason, my head won't remember a fourth thing. But when we come on to some of the next slides, the languages are on there. So what we found with the machine translation was, perhaps unsurprisingly, vastly differing results for the different languages, and the software definitely performed less well in the less well-known languages, which I'm sure for you guys is not, it's not a groundbreaking finding, is it? We know that machine translation, when you feed anything into it that's a little bit more complex or a little bit longer than general language, a couple of sentences, there's likely to be some kind of mashup really of language. And we did get some comments that were quite, almost laughable really. Some of the comments were things like, is this a crossword? What do these acronyms mean? What do these what are these agencies? So when you think back to the kind of messages that were coming out at the time, there was a lot of health related terminology around the pandemic itself, but there was also lots of information about the NHS and various other health agencies, political things as well. So those are exactly the sort of things that we found that machine translation doesn't really manage that well. So the messages that the tech companies put out about the translation software that they produce, we know that we have to take them with a pinch of salt, and it's a massive fallacy that we can rely currently on AI, Google Translate, or any other engines like that for our translation and interpreting these, particularly in sensitive areas like healthcare, which could, there could be serious consequences, couldn't there, resulting from reliance or over reliance on these tools. So, given that we were trying to steer people away really from just relying on machine translation, we started to build this document repository. So this is the resource bank that I've mentioned. We made it available on a WordPress site. So the WordPress site is the kind of front door, I guess, to the resources that we've made available. And the aim with this document resource bank was to find information from reliable sources which had either been produced in the target languages initially or had been translated from English. And the definition of reliable sources, I suppose in this case, is that they would have been produced in an environment where there would be some sort of review, revision, checks on the content and the language that was used. Because, what we wanted to put out there for people to be able to access was obviously accurate language. And some of the sources that we used were the UK government, because the UK government produced initially not very much that was translated, but by kind of January, February 2021, when we were almost the second year into the pandemic and the vaccinations were starting to come online, they did start to provide some translated guidance, but it wasn't always very easy to find. It wasn't always shared very well. We didn't think with local councils and the people that might be using actually wanting to use those resources. So that's another issue of there might be a lot of information out there, but then finding it, collating it, and having it ready to use when you need it is a big issue for people translating and interpreting in almost a kind of crisis situation. So we used some publications from the UK government that had been translated. We used information from other reliable sources like the World Health Organization that were putting out information. One of the things that we had to be pretty careful about was that a lot of the guidance that came out at the time was country specific. And if you remember, even, back a couple of years, it was even more location specific than that, because we had those different, I think they called them tiers, didn't they? Tier 1, Tier 2, Tier 3 counties or towns where you could do certain things and you couldn't do other things. So it was important that everything that we were providing was going to be useful in the situation in which it was intended to be used, which for us was Birmingham. So, we were very focused on the communities around us in Aston. Okay, so that was just a bit about building the repository. This was what it looked like. So we set up the WordPress site as the kind of front door, like I said. And if I click this should hopefully take us direct to the actual site. Take it off my PowerPoint, put it on the site. Okay, so this is the web page itself that I hope you can see okay. So Arabic, of course. How could I forget Arabic was the fourth language? So Arabic, Bengali, Somali, and Urdu were the languages that we'd started. In fact, initially it was just Arabic and Somali, and then we added Bengali, Urdu as we went on. Clearly, that's a tiny minority, actually, of the languages that are spoken prevalently in Birmingham, of which we know there are well over 100 community languages spoken regularly. And that's why what I'm showing you is supposed to be, it's kind of a methodology, it's just a case study, and hopefully it's something that could be taken further in many other languages by somebody or some people. Okay, so what we did was we put this key button on how to use this resource. So if we click here, this shows the aim that was to provide easy access to related healthcare guidance, aimed, as I said, for communities within Birmingham initially and perhaps wider in the West Midlands of the UK. And the secondary aim was to be able, so that these resources might be used then to inform further translation. So two aims: one, to try and put a lot of the guidance that was necessary at the time in one place, so people that were helping to spread information among their communities could find the information in their own languages and share it in their own languages with their communities. Secondly, that the resources could be used as a kind of, I guess, a corpus of texts from which could be extracted specific elements of terminology or ways of translating certain phrases and so on.
Hi, Sumaya.
More translations. So that was the front page.
Are you not able to come at 7:30 today?
That was the basic information.
Okay.
The actual documents we put into a database provided by a company called Airtable, which again is free. So all of this is open access, and it's free to build your own materials, as well as to, when we've shared the links and so on, then it's free for people to find. So what I'm going to do is show you what the database itself looks like, I hope. And there we go. So we'd collected these resources, and then we organized them into to languages and topic type. So you can see, you know, it's very clearly COVID related. There's face coverings, mythbusters, certain information about self-care, general guidance, quite a bit about vaccination because we were zooming in on that, and so on. And the database can be organized by language, so you can sort it by all the Arabic resources followed by Urdu, whatever. You could, if you wanted as well, organize it by topic. So for people that wanted to use it to find the, you know, as much as they could about a certain topic, you know, and a specific language, you'd organize it in that way. And then to access the actual resources, should be able to just click on a link and, oh, here you go, that's good, that's a not found one. Let's go for one here that I downloaded. So the documents themselves would be there and easy to find and access. If I go back a page, in fact, I will go back at this stage if I can to my PowerPoint. Is hiding somewhere. There we go. So as I said, the first aim was to make as much translated guidance or guidance originally written in the community languages available as possible in one place. Secondly, to then use those resources or to show other people how to use those resources to extract particular terms and whatever that they might need for. Oh, sorry, it's clicking on the links again instead of taking me through my PowerPoint. There we go. So the PowerPoint should be back up and running. The next page is an example of a glossary that we made of English terms. So I, as well as collecting the guidance in as many community languages, as much guidance in those 4 community languages as possible, I collected the guidance in English as well, so that I had a corpus of English, a collection of English texts, and I used a bit of a concordancing tool, so a tool that will extract terms and words and phrases from collections of texts to pick out the ones that were used more frequently, the very specific ones related to the topic, and so on. So this is just an extract from a glossary, and I picked these soft terms out because if you can read them, I don't know if they're big enough, but it's things like anti-vaxxer, anti-masker, bubble, lockdown, household, self-isolate, and so on. Terms that were very specific to the time, that I think were probably relatively unknown to the general public before the pandemic, but then were thrown around all over the place as if we all knew exactly what they meant. And working out what they mean, even sometimes in your own native language, isn't necessarily easy. So even things like, you know, terms like bubble, so everybody knows what a bubble is, but in COVID speak, you know, bubble was that term that was used for that restricted group of people. And then people were talking about how many people are allowed to be in your bubble, you know, who's in your bubble, and so on. And it's the sort of term that it could be really, really tricky for people trying to explain to their non-English speaking language communities what exactly it means. And then others like household, you know, what exactly is a household in terms of COVID. So So we took these terms out of the text and added just the very basic kind of language tagging information. So what kind of term it is. That most of these here are nouns, as you can see. Self-isolate clearly as a verb. At the bottom of the screen, you can probably hopefully just about make out there's some of these acronyms that refer to health agencies and authorities, again, that were being used and spread very, very widely at the time. So what we did then, we put a very clear definition in English of what those terms were relating to. And then we shared this with the people that were working with us as representatives for their linguistic communities. The idea being that they would then be able to add if there was a specific term in their language, they'd be able to add this to the glossary and share it more widely within the community, especially the people that were doing the job of informing, households, friends, families, neighbours about, especially the non-English speaking ones, about what the latest guidance was and what they had to do and couldn't do. So what we'd hoped to be able to populate this with terminology in each of the languages so that the glossary itself was available. We didn't quite get that far within the remit of our project, but one of the things that we did do was I gathered quite a lot of glossaries that were available on the net from some of these sources that I've mentioned, but none of them really had these newish soft terms in. So that's why we thought it was a useful and a good task really to try and organize these, and I would have liked to have got to the point where we did have them populated with all the different languages, but I'm hoping that as they were useful to help people really explain clearly what was meant by these terms. Okay, how are we doing for time? We're okay, aren't we? So moving on to the fourth outcome, which was the set of translation guidelines for self-empowered, community-based translation activities. So remember I said that these were provided for people so that they could use them themselves within their community to not to guarantee, but to give them more of a confidence, I suppose, in the way that they were translating or interpreting, helping other people in their communities. So what we did here was we produced a number of training videos. We put them on YouTube, and they're also available on our site. Just going to try and get back onto the PowerPoint. Sorry, try and get off the PowerPoint onto the, there we go, that should take us to it. Yeah, back onto the site, because the link to these activities and resources was also on the main site. Where is it? Here it is. So translator training videos at the bottom here. So these training materials, as I said, were supposed to be a starting point to, I suppose, spark some confidence, I said already, but also to just maybe spark some ideas in people's minds that they hadn't thought of about the complexity, I suppose, of translating and interpreting. So we put together one on the very basic principles of translation, I think, you know, when we talk about translation is quite an umbrella term, isn't it, which covers interpreting. And I know interpreting has some specificities that are not relevant with document translation, but a lot of this I think is very basic information which covers both translation and interpreting. So what is translation? First of all, why is it important to think about the purpose of a translation? So we're thinking about who we're translating for, what are the important elements of the message we're translating? Do we need to translate everything, or can we just pick out key elements? So those sort of things. How might cultural aspects affect our translations? So differences between cultures that might not be evident or apparent until you know you start to translate. And then in this first one as well, what's the best way to approach the task of translation? How do you start? So the videos are there. I'm not going to actually show you a video now because it's just me talking more, and you can I'll share all the links with you, so if you're interested you can explore these further. We also made available the slides that we'd used in PDF format so that they were easily downloadable. People could save them and use them as they wanted to. The second one was about translation challenges. So what do we mean by a translation challenge? What are the types of translation challenge? And then I take a couple of specific ones. So things that we've looked at already, acronyms. So in that that glossary that I showed you, there was those acronyms towards the bottom. So how do we deal with that sort of thing? How do we deal with proper names? How do we deal with those cultural differences that might exist? And then, of course, there's linguistic differences, and crucially, you know, what research resources are available to help with these issues. So the third one follows on from that one, and it's some ideas about how to research and make sure that the research that you're doing is from basically it's about using reliable sources, isn't it, and finding the right terminology that's going to be accurate and useful in your setting, and resources that are available. So the resources that are available, obviously there's many resources. We linked our own resource space here, and there's just a video explaining how to use that document repository. Another major resource, obviously, that we've talked about a little bit already is online translation tools, so machine translation, and how to use those tools ethically and effectively. So looking at what those tools are, how they function, how they actually work a little bit, and then what we can do to harness the power, because, you know, we all know that machine translation is really powerful. It can be really useful if it's used in the right way. So how we can use it in the right way to improve the quality of our translation, but also to improve the quality of the translations that the online tool produces itself. And then what do we need to consider? What ethical considerations, you know, should translators be thinking about, or interpreters, before they just blithely use online translation tools? So that, I think, was the last one. So that's just those adverts at the bottom, which you have to put up with when you're using free web platforms. Okay, so that was a quick whiz through a quick whiz really through the aims and outcomes of our project, and a very quick look at some of those resources that we put together. I realised, we look back on it now, it was quite a small scale project in terms of the actual language resources that we garnered, and clearly it was very specific to that period in time with with COVID and the bombardments that were happening, with new language, new terms around COVID, plus just the constant messaging that was coming out as well. So it's very specific in its content. The resource bank, not the basic principles. So in the videos and the PDFs and so on, I have used examples from the COVID project, but basic principles are basic principles, aren't they? Whatever topic you're working on. So what we think, I think and I hope that there is scope for replication of what we did, based around, using other topics. So other topics that are very relevant to the kind of minoritized language communities that we were working with. Health obviously is an ongoing one. So the project developed out of the iHealth project, and then we moved on to look at COVID and to see what we could do at that time. But I know from talking to Dr. Varney, who's the health director for Birmingham, that certain other areas like respiratory disease, some specific cancers, cardiovascular disease are really quite prevalent among some of these communities, like more highly prevalent among some of those than in the general community, and that having access to specific resources that are designed and developed in community languages could really be beneficial to Birmingham residents. So yeah, I do think that there's lots of scope for development and replication of the sort of thing that we did. So at this stage, I'm going to say thank you for listening. I hope you found it interesting, and I hope that perhaps it might have been useful as well to some of you. I said to Emmanuel that I'm going to put the link to the website in the chat, so I need to find the link and put it in the chat.
I've already put things in the chat. I've been busy.
Oh, you've been doing that.
Copying and pasting. So I put, but you can put it again because some people may have missed it. So thank you very much, Sue, for sharing with us those very practical steps you took. We now have time for question, and I see, Yvonne, you have a question so far away. We cannot hear you. You're still muted.
Hi, Sue. Thank you very much for your presentation. I'm an interpreter trainer rather than a translator trainer. So I noticed that when you showed us your list of COVID terms, that the terms weren't accompanied by any collocations, which are very important for interpreters, obviously. And yet later on, you did talk about using concordances, which obviously demonstrate language in context. So with the collocations for the terms, I was wondering whether you could say a little bit more about that.
Yeah, and actually I did include some collocations, but just not for that. I hadn't done that for the extract that I showed you, I think, or it might have been. It might have just been further on the spreadsheet. I'm not sure that I can find it quickly enough now to show you, but no, I agree. Yeah, absolutely. Collocations are vital, and that's one of the really useful aspects of the concordancing tool, that it will pick up frequent collocations. So yeah, that's a good point, and thank you for raising that.
Yeah, but unfortunately, many interpreters don't know about concordances.
No.
They've never been taught about them, although they've been around for a very long time, and they're always being improved. So, if there are any interpreters watching, do urge you to go online and look for concordances, because they give you so much information about the term that you're wanting to understand. So, thank you very much, Sue.
Yeah, I mean, a really simple one that's free, pretty easy to use, is called AntConc. So I don't know if I'm sure you've heard of AntConc. I will, I'll put the link in for you. So that's a simple concordancing tool that you can download. Yeah, you can download. The only thing about AntConc is it doesn't ever save what you've done, so you have to use it and then extract what you need before you shut your computer down, because when you boot it up again, it won't still be there. I'm just popping it in there for you.
Thank you. We've got another question from Lala. Is it Lala? Lala Burka? If you want to
Yes,
unmute
Lala
yours.
speaking.
Hello?
Yeah, hello.
Hi.
Hi, I am an Arabic and oops, sorry, I am French and Arabic interpreter. And when I had my training as interpreter, we were advised to look for the concordances in the on Google. Just because they send us, for example, you have tomorrow an appointment so and so, and it's related to eye or ophthalmology or rheumatology, whatever. Just the main to look for the main medical issues and to try to get an idea about it. And for example, when I attend a medical interpretation, and there is something I don't understand, even if the doctor tells me about it, I try to look for it online, to look for explanation, because I don't want to just look like a copy and paste. I want to understand what I am delivering. Okay, what I am relying to the patient. I want them to. I want to be able to pass the message. I want them to understand. And sometimes when I come back home to keep it for the future, I will go. There are some videos, medical videos on YouTube. I don't know, like say for example, for thalassemia, what does it mean exactly? Or any medical condition like this, something a little bit complicated to understand for us. So I'll go through that to try to understand as much as I can so that I can use it in another. Okay, it's not going to be the first interpreting meeting that I will be more knowledgeable or professional, but the upcoming one, at least, I will be better. So I wanted just to share this with the other interpreter because it's really, really very useful. And you get a lot of information. And I have glossary where I will add that new whatever medical condition and the concordances to it, next to it, in English and in Arabic. So it will be easy for me, or in French. I do both. So when I have the patient next time, similar condition, it will be so easy for me to go through that. Thank you.
Thank you for your intervention and contribution, Lara. I was wondering, Sue, if you were to give an advice for somebody who wants to work from a language that is not well provided in interpreting and translation materials, what would be the steps you would recommend they follow to do it? I mean, just to avoid maybe the pitfalls and the problems you encounter. What would be the right steps to take to do it properly?
I think probably echoing really what the previous speaker just said about researching the terms and making sure that you understand the terms really well, so that you can then transmit them accurately, and then keeping a bank of your resources. So building up your own resources, your own glossaries, and adding new terms when you come across them and you have to use them. I think that's the thing, being open to doing that research in the first place, probably, and then developing your own resources. If there's nothing else available, I mean, I can't imagine how difficult it is really in some languages where there's basically nothing there readily available. So if you're starting from scratch in a very lesser spoken language, then it's incredibly difficult. But I think doing that research, talking to people to make sure you really do understand the terms that you're going to have to be dealing with, and being quite disciplined about keeping your own resource banks, term bases, glossaries, and so on, would be probably, it's very difficult. And as I said, I'm not an interpreter, and I don't work with minoritized languages. I do work with pretty well known and widely spoken European languages where there is a lot of there's so much out there: French, German, Spanish, Italian. It's not difficult to find stuff in those languages. So I really feel for people, and have utmost respect for people that are doing this really difficult job in languages where there isn't stuff available. But yeah, that's the thing. I think a kind of disciplined approach is probably the best, developing those resources.
When you were working with those 4 languages you covered in the project, are there any website resources you could recommend that you found very useful and reliable?
Well, that's a good question. Most of the resources that we found, we did put in the on that website. There are some things. If you look carefully at the website, there are some links that are no longer active, which is a shame. But there are various places where where glossaries and term bases are made freely available. So one good potential resource that you may well have heard of, but you might not have done, is Translators Without Borders. And they provide a lot of information in a lot of languages. I will find, I'll put a link into them as well. And they develop glossaries for lots of topic areas. They did have a COVID one, but the thing about Translators Without Borders is that they do work in many minority languages. So that's worth looking at as well if you're not familiar. I think on the slides the videos that we made where I talk about research, I can't remember precisely what I've put in there, but there will be probably some links to other useful sites.
Okay, I see a question in the chat. Malcolm, do you want to voice your question?
I'm reading that, Malcolm, and I'm thinking, why would that be? I don't understand, but you're muted, Malcolm.
We still don't hear you. Unfortunately, I can mute you, but I cannot unmute you.
Hello.
Oh,
Can you hear me
wonderful.
now?
Hi.
I'm terribly sorry.
That's okay. We hear you now.
I shouldn't interfere really, but what I mean is that I know I'm in a different field. I was a defense advocate, but I know of some of my colleagues who disapproved very strongly, and I couldn't persuade them otherwise, of interpreters even making a note during proceedings, let alone referring to a glossary. I tried to explain to them that it was absurd, but my major reason for intervening was to encourage interpreters to stand up for themselves. They have the same entitlement to participate and intervene, really, as any of the other professional agents involved. Sorry, I hope it wasn't too much out of the subject zone you're focusing on.
No, I think it's completely relevant, isn't it? And I can't imagine why service providers would disapprove, because surely they want the best possible interpreting service available. And no, so that's astounded me, to be honest.
Thank you.
We may have time for a last question. So if you have any burning issue or things you'd like to raise. Yes, we've got Boyko. You will need to unmute yourself. Do I say not unmuting myself?
I'm sorry. I had a video interpreting today, and all the people were with masks, and I asked them to remove the masks because I couldn't understand what they're saying, and they look at me like I insulted them.
Yeah.
Is this the right reaction?
So I'm sorry, Boyko. So they were wearing face masks?
Yeah, all of them, and I asked them to remove the mask because I couldn't understand what they were saying, and they look at me like I insulted them.
Did they remove the masks though?
Only one of them did.
So they weren't minded to help you out then, were they?
Well, yeah.
Which isn't helpful, no.
Yeah.
Thank you. Yvonne, you wanted to intervene again?
Just a response to that last questioner, Boyko. Physical health issues override interpreting issues, in my view, as an interpreter trainer. And so I don't think you can ask somebody to remove their mask, even though it might facilitate your understanding of the body language of that patient or of that service user. So I really think that people wear masks for reasons that you may not know of. I myself have to wear a mask when I'm in public, by the way, because I have an autoimmune condition. So I don't really think that is fair to ask somebody to remove a mask because you don't know the reason for which they're wearing it. And physical health issues, in my view, override interpreting issues in that particular situation. Thank you.
We've got some suggestion in the chat asking them maybe to enunciate, to articulate, to speak slower when wearing mask. Or maybe if you cannot manage with the mask, you should maybe withdraw from the assignment and say, sorry, I cannot do it in those conditions.
I think I'm not sure if Boyko would. I don't know if it was their reaction that he said they reacted as if he'd insulted them. when is it an insult to ask if somebody could remove a mask and for them to just say, oh no, I can't, I need my mask on. There's a way of doing these things, isn't there, that kind of maintains politeness, which would be hopefully the aim for everybody involved in that kind of situation.
Thank you. I think I will just check. I can see a couple of hands. We've got Mustafa. The name is 21A Mustafa. And I've got a raised hand. So if you want to ask a question, please unmute yourself and ask it. No? Once, twice? We've got another question from Magda. Magda, do you want to unmute yourself and ask your question?
Hi, ladies. Thank you for your time. I am an interpreter from Poland. Well, I'm a Polish interpreter. I've been interpreting for an agency since 2019, and I have mainly worked in the NHS industry, social work, you know the gist, medical. So recently I decided I want more from this career, and I've applied for a DPSI course to interpret for the law. I understand that it is a bit more professional. You gotta, you know, interpreting for like the courts and the police. I want to know, because when I enrolled for the NHS, for interpreting for the NHS, we literally just had a 2-day induction, and they have just checked our skills of interpreting, of understanding the language. And now I am going to obviously expand my skills and interpret for the law, and you have to have the qualification. But on the website, they also have a qualification for the medical field. So I want to know, in your opinion, what does it, like, how does it work? Like, if an interpreter comes in and they have a qualification to interpret for the medical field, in comparison to someone who's just been doing it, like learning through themselves and through experience and things like that, like, what is your opinion on such a thing? Like, do you need a qualification as such to be able to be a reliable interpreter, or does it vary, you know, in regards to how you take the studies on yourself? Like, if you're able to do that and like take in the information that people give you, what's your opinion on it?
I guess that might be a question more for you, Yvonne, because it's interpreter training.
I've got two short answers. Yes,
Yeah.
you must have a qualification. And number two, even the diploma in public service interpreting is not sufficient. It is only an introduction to the skills that you need to be an interpreter. What you really need is a 3-year degree course at a university to be a professionally qualified interpreter, because the academic underpinning is also very important. So that's
Yes.
the answer. It's a stepping stone, a basic stepping stone.
In that sense, how do I, if I've been interpreting for the past 3 years without those qualifications, how would you class me? Am I just...
Okay, Emmanuel, would you pass my email address on to Magda, and then we can continue this conversation, because we've probably reached the end of our time now, haven't we? And it's a long and complex answer.
Thank you. I appreciate it. Thank you.
Thank you very much. If you want to know a bit more about how to make your work as an interpreter a bit more well, a bit more formal, you need to come for next month's session, because we will have a session about the national list of a public service interpreter and what it means to be part of that. So I guess that may answer some of the questions that were raised. So it's time for us now to stop. So thank you everybody for joining us tonight, for making time for this. I will send a feedback link to everybody who attended. Please take a couple of minutes to do that, because it helps us to know what kind of topic you would like to see covered in the talks. But also, if we have lots of demands, it gives us some ammunition to get more funding to organize similar events. So please help us to help you. Okay. Thank you very much for coming. And if you need...
Sorry to interrupt. I have a question for you.
Yes.
So are there any translated related certificates to pursue?
Yes, I've mentioned several times in the chat that if you require a certificate, you can contact me at e.labo at
No,
Aston.
not about this one. I'm asking generally for translation. Do you have like a specific degree or something that I need to pursue?
Well, at the moment, we don't have the funding for that. So we are doing what we can with the limited resources we have, but it's not on the card for the time being. Maybe later.
Okay. Thank you so much.
Thank you very much. Bye, everybody.